Hi, my name is Annie Robertson. I'm a Longwood University athletic training student, and this is my mini case number 3 on carpal tunnel syndrome. Carpal tunnel syndrome, also known as CTS, is most likely referred to as the cause of pain, numbness, and tingling in an individual's hands. On the screen, you can see the related anatomy, including the transverse carpal ligament, the median nerve, and the related tendons that run through the wrist. CTS is the most commonly reported nerve entrapment syndrome. The carpal tunnel is located at the base of the palm, just distal to the wrist crease. You can also see this on the image in the screen. It is bound on 3 sides by the carpal bones, which create an arch, and on the palmar side by the transverse carpal ligament. CTS occurs when an individual has increased pressure placed on the median nerve. In a study with 652 active workers with hand-specific force and repetitive characteristics, the prevalence ranged from 0.6% among workers in low-force repetitive jobs to 5.6% among workers in high-force repetitive jobs. The odds ratio for the high-force repetitive jobs was more than 15 compared to the low-force repetitive jobs. High repetitiveness appears to be a greater risk factor than high force. The most common signs and symptoms for CTS include pain and numbness throughout the wrist, radiating through the fingers. Some risk factors include gender, weight, age, and diabetes. Moving on to relevance to evaluation and examination. The evaluation process for carpal tunnel syndrome starts like any other eval. History will first be taken for the patient. This will focus on weight, age, gender, and diabetes, since these are the top risk factors for CTS. It will also be noted if the patient has a low or high force job, as well as a low or high force repetitive job. Observations will be completed, checking for swelling and discoloration compared bilaterally. Next, palpation should be performed, focusing on each finger and the wrist area. On the screen, you can see where the patient would feel the most pain and numbness. Neurovascular tests should also be performed to rule out any issues there. Here, you'll focus on the patient's fingers. Manual muscle tests will be performed bilaterally to find any loss of strength in the wrist or the hand. Special tests that should be performed to test for the presence of CTS include carpal compression test, which has a sensitivity and specificity of 80-92, Phalen's test, which has a sensitivity and specificity of 88-95, Tinel's test, which has a sensitivity and specificity of 70-90, and lastly, median nerve compression test, which has a sensitivity and specificity of 80-92. Continuing on to relevance to orthopedics and surgical intervention. There are many non-surgical treatment techniques for CTS, including different braces, taping techniques, and stretches to help relieve pain in the carpal tunnel. Most patients with CTS will be sent to physical therapy first to try and release the tension and pain. If physical therapy does not help, the patient must meet certain criteria in order to be considered for surgery. Usually, after 6 months, the doctor will discuss surgical options if they feel necessary. Carpal tunnel release surgery has 2 different techniques that it can be performed: open surgery or endoscopically. On the screen, you can see an open surgery technique. During open surgery, the doctor will make an incision that is approximately 2 inches long that runs from the patient's wrist to palm. During endoscopic surgery, the doctor will make 2 small incisions and will utilize a camera to perform the surgery. Both surgeries, the doctor will cut the transverse carpal ligament, which you can see in the image, that lies on top of the median nerve to release the tension and relieve symptoms. After surgery, the ligament will regrow together, however, it will be loose so that the nerve has more space. The patient will be placed in a splint or a cast for at least 2 weeks and will undergo lots of physical therapy to help regain strength and function. Most of the time, the symptoms will go away as a result, however, this is not guaranteed with surgery. The recovery period can be anywhere from days to months, depending on how the patient's body reacts. Here on the screen, you can see the references I used for my mini case number 3 on carpal tunnel syndrome.